everybody, and welcome to a presentation for our Healthy Professional Worker Partnership meeting. And this is the first webinar that will be led by our accountants team. So I would like to pass it over to Merridee Bujaki, who is the lead of the accountants team. Merridee, please go ahead.
Delighted to have everybody here and looking forward to actually sharing our preliminary results with you. I'm going to do my best to get through our slide deck. If we have not got a chance, I'd love to follow up with some of you afterwards. If you've got questions, please go ahead, put them in the chat, and I'll save some time for questions at the end. So looking forward to it. But before we begin, I wanted to make sure that we acknowledge the Algonquin Nation, whose traditional and unceded territory we are gathered upon, at least in a virtual sense today. And very much appreciating the opportunity to work and learn and collaborate in their space. So much appreciated. To introduce the team, so I'm Merridee Bujaki, professor of accounting at the Sprott School of Business at Carleton University, joined in this particular project on the mental health of accountants with Darlene Himick, who's here today, who's a professor of accounting at the University of Ottawa's Telfer School of Management, Suzanne Paquette, who is joining us from Université Laval in Quebec City, and our undergraduate research assistant, Hayley Touchburn, who's also at the University of Ottawa. We have been working for a number of years on this project. Some of you have been with us from the very beginning, and we appreciate that. Great to be able to then share some of these preliminary results. And I will go through many of the slides fairly quickly in order to be able to get into some of the detail. And as I say, these are preliminary results, so we'll focus on sort of high level insights, and we'll be doing much more work in the future as we go along. I did want to take just a moment with the first couple of slides, though, recognizing that for some people this might be a bit of a challenging topic to discuss. I wanted to make sure that you are aware, if need be, there are resources available should you be experiencing mental health challenges yourself. So they're certainly in an emergency situation in Ottawa, 911 if there's an immediate threat to life. That's an important one. There's other resources available for distress, individuals who might be in distress. And if you're not in Ottawa, there's a 1-800 number with Crisis Services Canada that you could reach out to. And then there are a couple of additional resources. Some of you might like to follow up on some of the things that you hear or some of the resources that are there. And so there's a number here around workplace strategies for mental health, for example, which is a Canada Life resource site. So that's something that might be good. And then the government and some of the other hang on, somebody keeps muting me. Are you able to hear me?
Yes.
Okay, I think we're good. Thank you. And for some of you who haven't come across it, you might be interested in Canada's National Standard for Psychological Health and Safety in the Workplace. It's not something we're going to touch on directly, but a great resource for organizations that are looking for ways in order to make sure that their workplaces are as healthy and supportive for their employees as possible. For those of you that might not be accountants, just a very brief overview about what the nature of being a professional accountant looks like. Accountants work in a number of different venues. Probably many of them will start their careers in professional service firms. where they are providing assurance and tax services that many people would think about. And the nature of work in those organizations is that the accountants are accountable to both their supervisors and on the way up to the various partners in the firms, as well as to their clients. Much of the work is seasonal in nature, and so you'll probably hear me talk about the busy season, which is when most of the firms are working on completing their audit engagements and also their meeting the tax filing deadlines for many of us. There are also client-specific deadlines that are issued, and the nature of most public service firms is that they're hierarchical in nature. So a fairly broad number of individuals at the lower level, perhaps not getting paid as much as when they start moving up, but it's often considered to be a bit of a pyramid in terms of shape. Other accountants work in industry, facing similar kinds of pressures with respect to monthly, quarterly, annual reporting cycles. You'll see the other category where we've got respondents are working either in government or other, which typically would include the not-for-profit and the educational sectors. And regardless of where professional accountants work, they are under pressure to pay great attention to detail because there are some significant both financial and reputational costs in terms of not attending to that detail. And we are working in an area where there's a lot of changing and regular changes to standards and expectations. And so it can be a quite challenging environment to work in. We've discovered as we've been going along, there is not a lot of literature that looks at accountants and mental health from the academic literature side of things anyway. And what there is typically has focused on the public accounting firms, and most of the research has been done using surveys. And so here we think our qualitative interviews will be able to really flesh out some of our survey findings. Much of the pre-existing literature is actually focused on burnout and the high levels of turnover that take place out of many of the public service firms. In this case, as Ivy indicated, we are reporting on the accounting case. So we are one professional case out of a set of 7, a bit of a mix of medical professionals as well as academia and teaching. So accounting is a really interesting counterpoint in this case. And we're talking just about our preliminary findings on the accounting group, although there are a couple of places where you'll see some very preliminary comparisons to some of the other professional teams. The big project itself is looking at mental health. Individuals who take leaves of absence from work for mental health reasons, and then what their experiences are in terms of taking those leaves as well as returning to work. And in trying to understand this as we go through our more in-depth analyses, we'll be looking at what are some of the individual factors for each person that make a difference in terms of their experiences with mental health, leaves of absence, return to work? What are some of the characteristics of their families, the nature of the organizations that they're working in, and some broader social or systemic factors? And so what we're presenting today are preliminary survey results, as well as some preliminary interview results, although I will warn you that with respect to the interviews, we're focusing just on people who indicated that they had some experience working in the public accounting firms. So we have not gone into looking at the experiences of people who are, say, working for the government or in industry. So just to get right into it, who are we actually looking at? And so the first part of the presentation is all about our preliminary survey results. We've got just over 300 accountants from across the country who responded to this survey. About 2/3 of them being women, 1/3 male. We'll see that same breakout, approximate breakout with respect to our interviewees as well. People were asked to indicate what designation they had, and so we've got about 80% of all the survey respondents who have their CPA designation, whether they've earned it fairly recently or whether they have the CPA along with a legacy designation. And for the most part, the nuns are going to be those that are in training. So it was possible as a trainee accountant to complete the survey. And then there are others who would be able, who would have identified, self-identified as accountant, but perhaps not had a professional designation, or perhaps we didn't list one that they might have had. We have got people working in all of the different areas, so public practice, industry, government, education, and it's approximately 1/3 of respondents in each of these areas. So that's sort of where we are, and it's fairly consistent in terms of the men and the women as to the places that they are actively working. With respect to work responsibilities, we did ask sort of where people were at in their career. And one thing that we found that is a little bit different is that the women tended to be a little bit less senior, and that they were reporting that they did not have managerial responsibilities, whereas of the men who were participating, there was a higher proportion of them who indicated they had senior management or partnership responsibilities. Don't hesitate to put questions in the chat. We'll get to them later. So, if there's something that you want to come back, we can always come back and look at it later. We did ask, because we know the nature of the profession is that many people begin in public accounting and then move on to other areas. So we did ask whether or not people had changed sectors. And it's certainly the case that many of them have. The reasons given for men and women slightly different. Women indicating if they had changed sectors within the profession, they were typically looking for better work-life balance and less stress. The men looking for more flexibility and reduced hours. Okay. Now, one of the key questions that we asked people was, and this is the actual wording of the question, in the course of your professional training or career, have you ever suffered from a mental health issue? And so we have, in a number of these slides that are coming up, distinguish between those people who responded yes to this question and those who responded no, in order to look at the experiences of those who have self-identified mental health concerns versus those that don't. And then, for good or for bad, we ended up doing this survey in the actual pandemic itself, but we did ask people to go back and reflect a little bit on their pre-pandemic experience as well. So we've got a few comparisons that look at the pre and the post, or the pre and the current COVID scenario. So one of the things we found was that self-reported mental health pre-COVID typically was worse amongst accountants who indicated yes to that question, have you ever suffered a mental health issue, than those who said no to that particular question. Having said that, though, even amongst those who indicated they'd had some mental health concerns, 34% of them indicated their mental health at a particular point in time when they were completing the survey was very good or excellent, although that's clearly not as high as the 72% of those who did not report such mental health concerns. And then one of the key takeaways is, and I think you'll have heard much of this in the media as well, that the self-reported mental health of all respondents, and I think all people, around the world really, has actually been impacted by the pandemic itself. And so the way we see that working out is actually to see that people's self-reported mental health really kind of dropped down one whole category. So that if you had said it was excellent previously, you're now saying it's very good. If you had said it was very good, it's now gone to just good. If you said it was fair, you've probably dropped down to saying that it was poor. And so this is what we're seeing there. And so you've got some of the statistics here. So that, compared to 72% who did not indicate they had suffered mental health concerns, who had very good or excellent mental health early on, that's dropped down to 29%. So that's, a very substantial drop, due to the pandemic itself. In terms of the kinds of mental health concerns that accountants are reporting, the primary one is anxiety, but followed fairly closely by stress and burnout, and that's true across all respondents. One of the areas where we did see significant change was with respect to depression. And so you see, we've split our respondents. Those in blue are those who indicated they had pre-existing self-reported mental health issues. Those in orange did not. And you can see here, if we come over during the pandemic, an increase in terms of the number of all accountants really reporting that they were experiencing or suffering from depression. And so that's probably the biggest shift. The good news on this slide really, post-traumatic stress disorder and suicidal ideation actually quite low amongst accountants. Our first slide, where we actually get to see a little bit in terms of how the accountants do relative to the other professions that we're looking at. So accounting here in blue, and women versus men. In this case, amongst the accountants, women tended to be more likely to report that they experienced mental health issues than men did. And this is a significant difference. So 59% of women versus 45% of men in the accounting profession. And you can see, that it is somewhat different from the other professions as well. I haven't got time to go through that in detail, but yes, I saw a question as to whether we would be sharing the slides, and that's certainly going to be feasible. We talk a lot in accounting about the quality of the work that's done and how important maintaining good quality work is, because accountants are serving a public, they're serving the public. This is a public facing profession, and we have an important role from a public interest standpoint. And so the quality of the work that's being done is important. And unfortunately, we're seeing that people were reporting that their mental health was actually impacting the quality of the work they were doing during the pandemic itself. And I've got a number of slides like this with these 4 different colored lines. And so I'll just take a moment to touch on those. The blue being pre-pandemic responses for individuals who had self-reported mental health concerns. The orange for people when they were reflecting on their pre-pandemic experiences if they did not have mental health concerns. Gray for those with self-reported mental health concerns during the course of the pandemic. And then I guess this gold or yellow is for the responses of those individuals responding at their pandemic experiences, but they did not have any previous self-reported mental health concerns. And so you can see for somebody who did not indicate they had any mental health concerns, pre-pandemic, 66% of them said mental health had no impact on the quality of their work. But if we move into the pandemic period and we're looking at the gray, you can see, the gray and the orange, you can see, yeah, we've got, over 50% of respondents saying that it is impacting their work to some extent, and about, what have we got? do the math here, 35%, by 36%, I guess, indicating that they're actually having a fair degree of their mental health is actually having a fair negative effect on the quality of their work. So I think that's something we should be aware of. Presenteeism, and I've just, for those of you that might not be familiar with it, it's the frequency of people going to work when they really should not be going to work because their mental health really is not allowing them to do it effectively. We're finding that presenteeism is a concern. So pre-pandemic, 27% of our respondents with mental health issues said they sometimes or often worked when they shouldn't have because of their mental health, state of mental health. Only 6% of those who did not indicate they had mental health concerns described having that kind of presenteeism. And essentially this doubled for those individuals who have mental health issues. So now 52% of them are indicating it's a concern, and it quadrupled for those who actually did not previously indicate that they had mental health concerns. So a lot of us going to work during the pandemic, really when we're not feeling all that well from a mental health standpoint. And so I think that's something that we should be concerned about. Having said that, however, accountants still indicate that most of them are able to get the job done. And so the question is, were you able to finish hard tasks despite your state of mental health? Pre-pandemic, almost everybody agreed that they were able to. During the pandemic, 90% of those who self-reported mental health concerns still either agreed or strongly agreed they could finish the hard tasks. And actually, it was those who had not had previous mental health concerns who were doing not quite as well. So only 84% of those individuals indicating that they were able to concentrate and to complete those hard tasks. And so we think as a team that this may reflect a couple of different things. Number one, we believe accountants are socialized to actually deliver results. And so many of us push through in order to do that. But at the same time, we do think that this indicates that those people that might have already experienced some mental health concerns have got some coping strategies that those who hadn't had those experiences we're just in the process of learning or discovering strategies to deal with some of the stresses with the pandemic itself. And so we thought that was actually quite interesting. In terms of burnout, and where did I jot down my definition in terms of burnout? Here it is. The World Health Organization describes burnout as feeling, a depletion of energy, a mental distancing from your job, and either negative feelings or a cynicism towards your career, and then reduced professional efficacy or productivity, all being characteristics of burnout. So the question is, how are we doing with respect to burnout amongst accountants? Well, 25% of those with mental health concerns reported some level of burnout before the pandemic, and that was 16% with those who did not have mental health concerns. However, again, you can see the impact of the pandemic. 56% of those accountants who responded, who had said they'd had some concerns with mental health previously, now indicating that they're experiencing some degree of burnout, and 32% of those who had not previously experienced mental health concerns. So the pandemic having a significant impact on people's mental health for sure. Where did some of those stresses come from? So we asked both about work stress and life stress, and so we can sort of distinguish between them. So pre-COVID, 24% of respondents with mental health issues found their work life to be either quite stressful or extremely stressful. And this was also true for 17% of those who had not identified a previous mental health issue. And this increased during the pandemic. And one of the questions that was tailored to the accounting profession to consider the nature of the cycles in terms of the work itself, approximately 80% of the respondents indicated that their work stress is impacted by the particular accounting cycles or the time of year that they're experiencing. Where do those work stress actually come from? Well, the bulk of it being here, regardless of what your background is and whether or not we're during the pandemic or before the pandemic, it's work overload and the presence of multiple demands and deadlines. And digital stress, as you can imagine, as we all moved into an online world during the pandemic, that increased quite a bit as we move forward. With respect to life stress, and the question is basically all other sources of stress outside of work. Here I think it's actually quite promising that pre-COVID, only 8% of respondents who did indicate they had mental health issues were finding that their life stress was either quite stressful or extremely stressful. However, for all respondents, whether they had previous mental health concerns or not, this was a significant increase in terms of the pandemic. And so a reminder, those are the gray and the yellow bars. So you can see, quite a few people feeling very significantly stressed in terms of their life. Although if you compare, the work stress amounts seem to be much greater than life stress. Life stress coming particularly from time pressure, not being enough time, and in some cases, those with mental health concerns, it was typically addressing their mental health issues that gave them the next greatest source of life stress. For those who didn't have those previous mental health concerns, it tended to be caring for children that was the greatest source in terms of life stress. However, life stress didn't change as much as work stress, and it does seem to indicate to us then that the key factors that are driving people's deteriorating mental health during the pandemic were in fact related to work rather than to their home lives. We did ask whether or not people were thinking of actually leaving, first their particular organization and second the profession. What we've got is, almost 30% of accountants with mental health concerns agreed or completely agreed that they were thinking of leaving their organization. And almost 20% of accountants without mental health, previous mental health concerns, indicated that they were also thinking of leaving their organization. So those numbers aren't significantly different from each other. 17% of accountants with mental health concerns actually thinking of leaving the profession itself, not just changing jobs, but changing professional occupations. And in this case, that's significantly more than the individuals, the 5% who are thinking of leaving the profession, who are not or have not suffered mental health concerns. So I think that's a little worrisome in terms of, how do we retain people both at the present time, but also how do we make this an attractive profession for people to move into? This graphic sort of tells the story, how accountants are doing. And again, the accountants down here in blue with respect to mental health. So of our just over 300 respondents, 52% of the accountants responding to the survey indicated they had suffered from a mental health concern or issue. Of those 52%, 58% of them made some changes to the nature of their work in order to address the concerns they had. 48% of the 52% indicated that they were considering taking a leave of absence, but only half of those who considered taking a leave of absence actually took a leave if they were an accountant. And of those, only 69% of those who did take a leave actually successfully returned to work. We've got the similar percentages for the all professional workers across the various cases. And I think the key thing to note here is that accountants were significantly less likely than the other professions to actually consider taking a leave of absence to address their mental health concerns. And when they do take a leave, they are significantly less likely to return to work successfully. So we've got some ideas as to why this might be. We'll have to come back to this and explore it in more detail in our future work. With respect to those leaves, what's the most common reason for taking a leave or for not taking a leave if you thought you should have taken one? Frequently, the respondents said they didn't see their particular issue as sufficiently serious to warrant a leave. But a second, an important concern for many of them was with respect to the professional impact and concern over what a leave for mental health reasons was going to do to their career. What are some of the kinds of changes that people made to their work itself in order to try to address some of their concerns? And the most common really just being taking either a sick day or taking vacation days. There's a few other ones you can see there. That the second broad category, looking for some support from an allied health professional like a psychologist or a counselor. And men and women were equally likely to try to make these changes. What are some of the other kinds of resources that the accountants indicated they had accessed? The most likely formal support being their family doctor. But there's a large percentage here, 18%, who said they did not actually access any formal mental health supports. And only 3% indicated that they had accessed a wellness program or another form of support like the CPA Assist or the LifeWorks programs that the accounting profession have put in place. And so there might be something that could be done moving forward by the profession itself. We found that having a supportive supervisor is a really important part of both taking a leave when necessary and then also successfully returning to the leave. But the biggest barrier actually that people reported was the financial consequence of not necessarily having the necessary financial coverage for a leave of absence for mental health purposes. The top barriers are also related to supervision. And so a barrier to taking a leave, an unsupportive supervisor, or if you happen to be in a unionized environment, an unsupported union representative. What helps people come back? Again, the importance of that supervisor and then appropriate policies, programs, or services to help you get back. And we've got one other gender difference here, a slight difference with respect to those that take a leave and return to work. Returning to work after a leave of absence actually less common amongst women accountants than amongst the men. And so 66% of the women return to work successfully, 80% of the men. The driving factors still largely to be determined in that. And again, you can sort of see there's quite a bit of variability across the different professions. So key insights from the survey. COVID-19 clearly increased stress for everybody with negative self-reported impacts on the quality of work people were doing. Anxiety, stress, and burnout being the key mental health concerns, with work stress being a bigger concern than life stress factors. The accountants are less likely to take leaves of absence than other professions, in part fearing the impact on their careers, but also less likely to return to work after leave. So perhaps we're actually waiting too long to take a leave if one's necessary. Supportive supervisors are particularly important for people both to take a leave and then to return successfully. Relatively few differences that we're seeing so far between the male and female accountants, though as I noted, female accountants less likely to return to work after a leave of absence. And then worrisome numbers really in terms of those who are thinking of leaving their organization and leaving the profession. And so on balance, we think some of these findings suggest that there are some systemic challenges within the profession itself in terms of the nature of work, and that might give rise to some looming staffing issues down the road. With respect to our preliminary results for our worker interviews, here we did 32 interviews in total. It's very similar in terms of the mix of who we spoke to as to who responded to the survey. So roughly 2/3 women, 1/3 men. We did ask about people's visible or other minority statuses. We did speak to a number of francophones. We'll be exploring what these personal characteristics mean as we go into the analysis further. We did have an equal number, and actually we had worked really hard to make sure we were speaking to people who had taken a leave of absence so we could sort of see the full spectrum of that process and how it played out in their experience. And we talked to people who were fairly new in the profession, just 2 years in, right up to some who had retired or partially retired with 37 years experience. As I said, we had the first number here being the number of people who are working currently in a particular role. So 9 in public practice, 12 in industry, 5 each in government and other. Again, a fairly similar mix to those that we saw in terms of our survey responses. The 18 indicates those who had said during the course of their career, they had worked in public practice. And so it's this group that we are talking about in terms of our preliminary analysis here. And then just a reminder that, the nature of qualitative research is quite different. We're not trying to extrapolate to the population of accountants. We're trying to instead reflect people's individual experiences, give voice to their stories. So the quotes that you'll see are illustrative, but at the same time, we identified 10 distinct themes in the interviews that we have looked at in depth so far. And so when we say it's a theme, it's something, it's not just an individual person, it is a recurring theme in terms of people's comments. So, this will not reflect the experiences of all accountants, but they certainly do indicate that there are some accountants who've had these experiences. So I'm going to focus on the high level in terms of the themes. I'll leave you to read some of the key quotes as we go along. But for many of the accountants that we were speaking with, they see their workplace as essentially a family. They spend a lot of time with them. They get a lot of support and mentorship from them. And so that's generally a very good thing. But then we also heard from a number of them is that family can sometimes be a bit of a dysfunctional family. And so a sense of judgment if they did take a leave of absence, for example. So they were feeling that their work family was seeing them as abandoning the rest of their colleagues when they took a leave. And others who referred to the fact that, you know, they didn't want to take a leave of absence because they would feel so guilty because it would increase the workload and the burden on the others in that extended family. Our second theme, you know, really was, you know, and as we described at the beginning, you know, comments on the cyclical nature of work in the accounting world. And the interesting thing is many people spoke about how they could get through the busy season, they could get through those high peak demands for work, knowing that there was going to be an opportunity afterwards in order to, you know, take some time off to sort of recenter themselves, to restore themselves. You know, so, you know, they know there's an end in sight during the busy season, so just hang on until you get to the end of it. You know, or I know it's going to be 2.5 months of suffering, but after that, I'm done. And that, you know, I've kind of relied on that opportunity to reset. But at the same time, we were hearing from many of the accountants that cycle is not as pronounced as it used to be, that things tend to be busier year round. And so where people had really relied on that opportunity to sort of have that bit of downtime, for many of them, they're finding it's not there. And so they're not getting that opportunity to sort of balance things out over the course of the year. And so that was certainly a concern we were hearing from a number. We also heard that there are a number of accountants, and this is our interpretation, not their words, but they seem to be socialized to expect an excessive amount of work. And here we were hearing from accountants, you know, telling us about their experiences that working in a public accounting firm, for many of them, their first sort of real job, not knowing any different in terms of what work was. So they got used to working excessive hours. And we're frequently talking, you know, I should say here, 9-10 hours a day. You know, so 50, 60, 70 plus hours a week, for some of them, not that uncommon. And they really didn't know that there are other workplaces that might be somewhat different. And in terms of the socialization, you know, we sort of hear it in the second comment. You know, the first year, you really don't know what you're signing up for. But by the second year, you're more familiar with it. So you have become socialized or accustomed to those hours of work. And then there's a few just, you know, amazing quotes like people actually brought sleeping bags and slept under their desks. So, you know, very hardworking, lots of work, lots of hours. We did hear similar themes in terms of the types of stresses that accountants indicated that they were experiencing. So that timeline or the deadline stress, the stress of needing to feel like they're maintaining their competency, staying up to date and current, and being expected to be able to provide the answers. So that was causing some stress. The stress of managing what can be sometimes quite difficult communications, communicating bad news both to your clients and to members of the staff. Again, this idea of digital stress coming up. And I thought it was really interesting, you know, hearing that actually the way the supervisory relations work out in many of the public accounting firms, that some people were actually finding that stressful. So in this case, this last quote, you know, part of me gets very stressed by supporting other staff members' mental health. And they were just kind of wishing that there was somebody else who could take that responsibility. So we'll come back to that in terms of one of the key insights. But yeah, that mentoring, that close connection, the various reporting relationships actually causing some stress for the supporting individual as well as the individual who had reached out looking for some support. With respect to our fifth theme, and we've got 10 of them, so I'll just keep going along here. Just introducing a concept from COSER. This is the idea of a greedy organization, which is an organization which demands total commitment from its employees. And when COSER was writing, was talking mostly about the military and or religious orders, where there is no distinction between work, home, leisure. We're seeing similar ideas here in some of the comments we were hearing from our interviewees. My family think I'm insane for working the number of hours I do. My friend loses me for 3 months. You no longer have time to actually do things that de-stress you. Needing to be told, needing some policies to let people know it's okay not to work, to log off and go home. And I love this idea of the Sunday scaries. You haven't worked all weekend. Now you're really concerned on Sunday what you're going to encounter when you go back to work on Monday. A couple of themes are a little bit more worrisome. A number of individuals told us they really didn't think anybody in their organization was listening to them when they were concerned. So one saying, they weren't listening. I wanted to be on a different kind of job. I kept saying that's what I wanted to do. They'd say yes, but then I'd end up back doing the work. So really prioritizing the client service component rather than the mental health of the individual. Another one saying, I was having difficulty in my pregnancy, and everything they were being told at work is, well, stop doing everything else in your life so you can concentrate on work. And the sense being that this woman, thought the firm really didn't care at all about her health. It was just about delivering the work. And then for somebody who'd returned to work after a leave, having negotiated that there would be certain tasks that would be removed when they came back, saying somehow magically they reappeared on my plate. And so a number of accountants signaling in different ways. They thought nobody was hearing them when they said they needed some adjustment or some consideration. Going along with that, there's this sense that the accountants, when they do need something, that they're supposed to find their own solutions. So there's this heavy expectation for lots and lots of work, and it is up to the individual then to know and respect their own limits. So that would fit nicely in with the greedy organization, that the organization will take everything you can give it. You have to be the one to put the brakes on. But given that hierarchical organizational structure, it can actually be quite challenging to speak up and advocate for yourself. Being vocal for what you want, that's actually fairly challenging. Although we did have one who said, I pushed for a month, I really did advocate for myself because I needed the rest. And in this case, it wasn't a mental health leave of absence. It was one for a physical concern, but they were clearly making the connection that, they needed it for mental health reasons, but the legitimate argument was I needed it for the physical health ones. Some comments certainly around some of the systems being problematic, and here are systems that are actually encouraging overwork and competition. I'm going to just keep on going. To some extent, people actually seeing this as exploitive. Although that's not a word that they used themselves. That was certainly the title that we gave the theme. There's just no system to take the work away when somebody's not there. Some concern that the partners are taking on jobs that are profitable or lucrative, but not necessarily thinking about what the implications are going to be for the staff that have to get the work done. And then, whoops, sorry. A concern, this is a particular one for the pandemic, where staff were originally asked if they would go down to 80% workload, 80% pay in the early uncertainty of the pandemic, but then realizing the staff were actually, or at least this individual was, working as much and more as usual, but now only getting paid 80% for it, and nobody monitoring that in order to see that that was a concern. The 10th theme, the good news, leadership can make a difference. And we heard both from employees and partners who were interviewed saying it is possible to have a different culture in their organization, where there are partners who get together and look at the utilization of the staff and say, how can we shift things? Some firms where people are allowed to bank their days so that if you've worked a crazy March and April, you can take those days off later when things are not quite as busy. Systems in place so that clients have multiple points of contact within the firm. So if somebody's away, somebody else can build on that relationship and still serve the client's needs. And I like this comment too. In my new organization, I don't actually work more than 40 hours a day, which is very strange to me, which comes back to a lot of the accountants being socialized for this overwork. So key insights, and then yes, we'll get to some questions. Most individuals join public accounting firms at a very young age without experience of other modes of work. They are socialized to believe that overwork is normal. Many of the accounting firm practices tend to promote that culture of overwork, and individual accountants are expected to advocate for themselves if they need something, but they do anticipate there will be career costs if they ask for some accommodation. There are fewer opportunities today than earlier to reset after those busy periods. The accountants themselves expected to supervise and mentor, frequently without formal HR training, and so feeling that they are finding that challenging themselves. Some accountants are feeling unheard and exploited, but there are some healthier workplace cultures that are possible with appropriate leadership and commitment. Where are we going from here? Well, we're going to continue analyzing both within the accounting profession and across the other professions, the surveys and the interviews. And as a team, we're looking at trying to identify what are best practices or wise practices in terms of interventions. We'd be interested in if any of you or your organizations might be open to working with us to try to pilot test a few interventions that might be helpful in terms of helping individuals address mental health or helping to create cultures and policies which are more supportive of people's mental health. And last, I just want to say thank you to all of those 300 plus accountants who responded to the survey, our interviewees, and we had many more that we could not interview that would have liked to, and our various research partners, in particular the CPA Canada, the Chartered Professional Accountants of Canada, have been with us working as partners. It's probably 5 years now, not just the period of this grant, but the previous one, which was getting all the pieces in place. And so that has been much, much appreciated. Apologies, I haven't left a lot of time for questions. I'm willing to stick around if there's a bit after that, but we've got about 8 minutes. Has somebody been monitoring the chat for questions, or can we open?
Yes, absolutely, Merridee. So thank you so much. What an incredible deep dive into a very rich data set. And so yeah, really important findings that are coming out. There were some questions about getting access to the slides. We will do that for sure. Also, we will be posting the webinar to our Healthy Professional Worker website and our YouTube channel. So please keep track of it there. And I've also posted in the chat a link to the accompanying infographic that you can download and post. And we are getting some questions in. So from Rosa, was there any division between the large Big Four type firms compared to more regional or local firms in terms of results?
Thanks, that's a great question. Keep in mind, these are preliminary findings, both for the survey and for the interviews. We have not gone in depth in looking at the size of the organizations, but certainly there is a sense that yes, there are some differences. We were hearing some of the promising practices really at the mid to smaller size firms where there were individuals, and I would say actually frequently women, who were having a significant impact in terms of the leadership at those organizations. So it will be really important for us to follow up on that question as we go forward in terms of our analyses to put some numbers, as it were, around that gut feel that we've got as a team.
Absolutely. Thank you, Merridee. Bernie Sutton put in the chat, wonderful presentation, thank you. Is there a strategy to roll out the findings and socialize them?
Thanks, Bernie. Great question. Yes, we have an emerging strategy. We're trying to do this so that we respect our mental health as well as get these really important findings out. Being accountants, we're tad reluctant to send things out too soon. So we do want to make sure that we've done all of our due diligence and, delved into all of the different possibilities, looked at the full set of responses as we go forward. So yes, what we are hoping is that we will have both academic publications. We had a sort of a piece in the Think 2020 magazine last fall. We're in discussions about having a fairly accessible piece, written in an accessible manner that would come out there sometime in 2022. We have had some preliminary discussions with some of the accounting professional bodies as to whether or not we could present either in one of their conferences or one of their events. So we've got a number of different strategies that are both academic and professionally oriented. And then there will be other ones where we actually start working as part of the broader team, where we start looking at some of the insights that can be shared across the different professions. Because, my sense in listening to some of our discussions within those broader professional conversations is that organizations that are more or professions that are more highly unionized often have some really interesting insights and policies and practices that might be able to be modified and brought into some of the other professions. And we're looking forward to doing some comparative work, most likely with the dentistry profession, because they run practices, professional practices that are not that dissimilar to what the accounting professional practice is like. So there's a whole bunch of research and a whole bunch of different strategies. We've been supported with some great infographics looking at this. So, those will be things that we want to try to do to get some of the ideas out and just hopefully encourage individuals, employers, the professional associations themselves, and society broadly to be thinking about these really important issues around mental health and what we can all collectively do in order to support ourselves, our colleagues, and others around us.
That is super. Thank you so much, Merridee. I think that mainly rounds out the questions that we had. Thank you also for the shout out to the infographic, which is in the chat, but you can find it also on the the accounting team on our Healthy Professional Worker website. So just to respect everybody's time, we will call it to a close. And thank everybody for their participation. But as Merridee mentioned, if you would like to stick around, have more comments and questions, we're more than happy to accommodate that. But I'm just going to stop the recording and wish everybody a good day. Thank you so much.
Thank you. And if you've got an organization and you'd like to be involved in the intervention phase of things, that's what we're focused on for the next couple of years. Certainly reach out. We'd be happy to hear from you.
Indeed. Thanks again.